Well, the way we were introduced was through Shining 3D Dental. And I'm an implant dentist, and you're essentially an expert when it comes to printing. You've got a lot of computer backgrounds. You've helped me out with that scanner, and so that's where I want to start. I want to talk about how I started in 3D dentistry. It was through CEREC. So I had Prime Scan, and I think I had the blue cam. I think I had the red cam in Wisconsin.
Okay.
And then the blue cam, and then the Omni cam, which was worse than the red cam, or worse than the blue cam. It was probably better than the red cam, but I remember the blue cam feeling like, man, I think it was easier. When
was
just straight
that?
Scanning. 2008, I think.
Okay, sounds about right.
Something like that, around that time period. The blue cam, I think it was like really square, boxy. It was pretty big. And you wouldn't move the camera around. You just like stay straight with it. It did pretty good. And I had in-lab software. So I was doing 50 millimeter blocks. So I was doing bridges, long span, replacing posterior bridges sometimes. And then Omnicam, I feel like it was limited. I think they went smaller camera. They had a smaller camera to make it like a little easier in the mouth but that had some big limitations. I think because you're looking for some spacing between the cameras, that you're limited, because the more stereoscopic vision you have, the farther away your eyeballs are, the better depth perception you have.
I see.
This is why like owls have like super great depth perception. Or like it's pretty cool in nature. Like animals that have like eyeballs on the side.
Yeah.
They can see here, but they can't really tell depth perception from up ahead as well.
Sure. Like a rhino, maybe.
Yeah, exactly. Or like a deer can like look for threats.
Yep.
On the sides. But an owl is definitely optimized for like depth. And so the blue cam was, I think, because it was bigger camera, it had advantages. The Omnicam was a smaller camera, which was like maybe easier to maneuver in the mouth. But I think that it really suffered from that. So then we're at the Prime Scan now. Felt like that was the last camera I'll ever buy. So I went like big in it. I bought 3 of them.
Sure.
Which I think is a mistake. Like I wish I would have only had just 1 or 2.
It's expensive too. I mean, those cameras, they are not cheap, and the whole system that comes with it. I mean, they kind of get you with the subscriptions, this and that, and it really adds up. But it really does say something, though, that you were a pioneer doing this in 2008 or even 2010, for that matter. You were on the very early part of the bell curve for people adopting, CAD CAM, getting into 3D dentistry. So the fact you've been doing it for so long really says something, and you're still here doing it and evolving with it. It's really come a long ways since 2010. Even since 2018, 2019, it's come a long ways.
Wow.
So
nice. Yeah, I'd like to talk to you about that. I mean, the thing that as a dentist who immediately learns lessons, if you're a dentist that is outsourcing to a lab, you won't learn those lessons of like how you prep the teeth, or your like your clinical excellence,
the things you're looking for. And
your clinical excellence is directly tied to what you just did 5 minutes ago. When you're in CEREC, you really learn how to control that environment really well. So you learn how to polish the adjacent teeth and like make sure the draw is and the crown preps are perfect. And so it really teaches you to prep really well. And labs tell you that.
And what do you mean by the draw? And I might ask some simple questions at times.
Yeah, a simple crown, especially a bridge, you have to make sure that the walls are parallel. So if there's two walls, and then you have like this one like this and this one here.
Yep.
The crown is kind of swims in place, right, when it's seated. So if it's blocked over here by this abutment, then you're going to have a problem with seating it. You're going to have some consequence there, and you might not know it. So you have to really that I think the easiest way to name it is draw, or like parallel walls.
Eliminating undercuts or minimizing undercuts in a sense is what that is getting at.
Yeah, you have to be able to draw, completely vertically, and I think that James Klim was a mentor of mine, still is and he's a wonderful guy, and he taught me that there's really three things that you want an adequate reduction for space of the material. You're limited there. I mean, the material thickness has to be at a certain minimum. And then you want to have parallel walls, or like the taper is important.
Yep.
And smooth. Like the margins have to be I'm actually polishing margins now. So it's not like polished like enamel, but it's basically a polishing burr. For the margins cannot be bumpy. The smoother the margins, the better.
Right. It's interesting you say that. So I got the opportunity to attend a Coy Center lecture, Dr. Marta's digital practice course. And in the course, she talks about the anatomy of scan bodies and how important they are. And every scanner in the CAD/CAM space, it can kind of struggle with really, really sharp edges. So if you're looking at like a square or a rectangle and you go to those 90-degree angles, they are really hard to capture super accurately. Whereas if it's a rounded edge, maybe something that's a little bit more polished, the scanner and the technology just picks it up better and is able to read it better versus the super straight line. So it's interesting that you know, if you're polishing them, that's probably a pretty good reason why that you're getting better fits. So
yeah, so that's a principle. I'm glad you brought up the Coy Center. They're doing scientific research on that. And then also the last one is like the contacts. So like the adjacent contacts for those perfect flossing, that Goldilocks, like not too tight, just right. So those three things are something that like are really important when you're doing your own lab work, which basically is when you're a CEREC doctor, you're basically the lab tech, the laboratory technician, and then through the prime scan, I've gone from like one milling machine to three, and into my last one was zirconia. I didn't during that time the prime mill was like going through early adoption.
Sure.
So there was, it sounded like it was really bad based on like all the Facebook threads. So I kind of was like, I'll go back to the wet dry mill.
Yep.
Which was right before. And so I stayed there.
Were you using it both wet and dry, or were you just
No, I had two MCXL wet mills, wet grinding. So I was wet grinding Emax with the two mills. So I kept the dry mill dry.
Smart.
And I didn't go back and forth. I mean,
that's the best way to do it.
Yeah. So we just do zirconia in one and then Emax in the other one. And I've used other materials, but those are my favorite. And so, yeah. But then I had some difficulty scanning soft tissue for anything full arch, basically, from night guards to partials to dentures, those kind of things, and it's really hard with the prime scan. So we would use powder or whatever.
It's always funny when I get that question now. Like, do I have to do any powder? And I'm like, no powder. It hasn't been that way for 10 years. So some of the scanners still did require them, or they could function better. But you always hear those nightmare stories of I had to spray this powder in the mouth, and I'm like, oh my goodness, like
Yeah. So that seemed to be better. So I was spraying OptiSpray, and then I found out about the 3D shining through. It was really Instarisa. I think the first time. Instarisa is an excellent organization. I love those guys in Fresno. Art Miralis is a great guy, and he's a Coist instructor, and he's meant so much to me. He's guided me in many ways. And Shining 3D was there with a denture course that I attended. Sid Parker, another Coyce dentist, was there, and we had a Shining 3D chairside for a denture exercise. So from there, got a hold of you, and we started together. And from then on, it's been excellent. Probably the best compliment I can give to you is that my assistants love it, and they love the native software integration, which is how you basically take it from the scan to get to the lab. I still feel like there's so much more to learn because they've been using my clinical partners have been using it exclusively. So I'm not using it as much unless I have unless I'm working on weekends, which I would never do.
But working with the scanner exclusively, you mean?
Yeah.
Okay.
Yeah. So I'm not using the scanner. I mean, I did when we started. I should probably get back to it, just so I know how to do it without any help.
I see what you're saying. Yeah. And it's nice to hear that your assistants are loving it because they're generally the ones that are using it the most. Mm-hmm. But, I'm happy to walk you through any workflow anytime, spend the time to do that with you. And what's great about our scanner is the fact that the assistants love it. Whenever I walk into an office and an assistant has experience scanning with a bunch of other scanners or just one scanner, the second they pick ours up, they're like, oh my gosh, it's so light. And then once they start scanning, the look on their faces is priceless every single time.
Exactly.
It's amazing. It's so easy to use. It's so unbelievably fast. That's the reaction I get. I love working with this company because it's quality technology that we have. It's cutting edge, and no one has the same scanning technology we have. And it's really something that differentiates us with us having a background in the scan world or scanning CAD CAM world before even they got into dentistry. That's the reason being no one has the same technology we have because it's all developed in-house by us.
Okay.
And so when I say that, it leaves an impact on people because they believe what I'm saying because they're using it in the mouth and they're seeing how fast it works. And they're like, wow, this is actually true because I've scanned with other companies and other scanners and they aren't this fast and easy to use.
Right.
So that's why I get that reaction.
Right.
It really sells itself, and it's an amazing product that they've developed.
Is there something, with physics or computer software that you think, because you have a background in computers, so I wonder if there's some, from a basic level that makes it different.
Yeah, there is. And a lot of that is kind of IP, intellectual property. So they actually, don't even share with us a whole lot. But essentially what it comes down to, speaking in kind of like, broad terms, is the camera technology and the resolution they're using is kind of proprietary in a sense that each company like 3Shape or Itero or Shining 3D, they all build these cameras or outsource or get these cameras from some other company. And the way that they talk to the software is different. It's in the code and the AI that's developed. And so it's the resolution of the camera and the way it's talking to the software. And that's where we get all these differences in image quality and accuracy. And that sort of thing. And so, it comes down to frames per second, but ultimately it really comes down to resolution of the camera and the way that the camera is talking to the software.
Yeah, I think I understand a little bit about, I've learned a little bit about the iPhone and how it might not have the type of megapixel resolution, but it does have some software that helps take better pictures through intelligence. And there's probably something like that, that software optimized.
Yeah, it's all in what the people actually writing the code are doing. And I don't understand computer science all that well, other than the fact that I know whatever they're doing a good job at it. But it's interesting that resolution isn't always the higher the resolution doesn't necessarily mean it's going to be that much better. It's in the way that it's actually talking to the software. So if it's a lower resolution, you might not even know, and it's still going to be just as good, if not better, because of the way that they all talk to each other.